Welcome. On behalf of the Center for Occupational and Environmental Health, I would like to welcome you to our webinar, Farm Policy and Chronic Disease, How Are They Linked? Presented by Dr. David Wallinga. A few housekeeping items first. You'll be muted during this presentation. If you would like to ask a question, please enter it to the online chat or Q&A box. We'll be pausing a few times throughout this presentation to address questions. After today, the webinar will be hosted on YouTube and a link will be provided to you via email. At this time, I'm pleased to welcome our presenter, Dr. David Wallinga. Dr. Wallinga is a physician and the Senior Health Officer at NRDC's Healthy People, Thriving Communities program. He has more than 20 years of experience in writing, policy, and advocacy at the intersection of food, nutrition, sustainability, and public health. His current work focuses on the enormous overuse of antibiotics and human importance in U.S. livestock production, a practice that continues to worsen the global crisis of antibiotic-resistant infections like MRSA. Thank you so much for joining us, David.
Hey, thank you. I'm really glad to be here this morning. So I'm going to dive right in and just say that for those of you who don't know NRDC, we're a big national environmental group with offices in, I think, about 6 cities, 600 staff, a very sizable budget. We have many lawyers, many scientists. I'm the only physician, but we've got a very substantial team working on food and agricultural policy issues, which I'm going to touch on today. So just wanted to review some of our learning objectives for the webinar, and I'll be using those to frame my talk today. And I'm going to divide this up into, I think, 3 or 4 sections with these blue screens. So first thing I want to do is just kind of lay out and compare some of the framing that we often use unconsciously in medicine and health, and also around food, kind of the framing that has been more predominant in the past versus the kind of framing that I'm going to propose. And it's a question of choice, individual choice, versus environmental determination, more or less. You'll see what I mean as I speak. So one way to lay out the context of this is that I see a lot of crises facing us, both in the health system and the food system. And some of the biggest ones have been mentioned. One is the crisis around obesity and related disease. So now we've got a society, a food system, a food environment where 1 out of 3 children are overweight and obese, and 2 out of every 3 adults. And this has enormous implications, not only in terms of health, but future productivity of the workforce, enormous healthcare costs, which are only going to get worse, and a lot of morbidity as well as early mortality. But another crisis, which is also huge and growing, is a crisis around antibiotic-resistant infections. And according to the CDC, we've got conservatively at least 2 million such infections a year, 23,000 deaths, and again, huge costs both to the individual but also to society. And a lot of these resistant infections are linked back to the use of medically important antibiotics in our food system. I'm going to talk a little less about this today because you're going to hear more about it on Thursday, but we can touch on it in the questions if you'd like. So in the past, if you think about the practice of medicine, even up until the last 15 or 20 years, it's usually been framed in terms of individuals, and it's easy to see why. A clinician will be in their clinic or in the hospital, and a patient walks through the door, and the first thing you say is, "What brings you here?" And typically, you're expecting to have them bring up a complaint. And so you're focused on, for example, the kid with the ear infection, or more recently, people walking through the door that are overweight and are having problems with that of one kind or another. The problem with hanging on to the frame of individuals when thinking about something like obesity is that it doesn't work very well when you try to come up with solutions. So, in fact, approaching individuals who are obese with advice around changing their diet or other changing their behavior is not very effective. Once they've developed obesity, it's enormously resistant to treatment and also very, very expensive. So really, the much better approach from a society standpoint is to try to prevent the obesity from occurring in the first place. And inevitably, that kind of framing about prevention rather than treatment is a frame around the system, not around the individual. So the way I think about the difference between the two is that in the medical model, it tends to be reductionist, again, focusing on one or two problems and the individual. Systems thinking is relational. It thinks about all the different factors that might have made a person develop obesity or related disease. Looking forward, a medical model tends to be problem-based. That doesn't work really well when thinking about systems because, and we could talk more about this, but systems, the problems kind of shift over time. And so the goal isn't really to address individual problems, but to think about the things that make a system maintain itself and keep functioning. So it focuses more on resilience. Medical model likes to think that there's a single cause and effect relationship. So, the typical approach would be people aren't eating well, therefore they get obesity or related disease. And so the solution is to try to get them to eat less, but that doesn't work terribly well, as I said. And then we like to talk in medicine about evidence-based medicine. And usually the gold standard in terms of evidence-based medicine is something called a randomized controlled trial. This is a very expensive trial with a lot of individuals recruited. And the problem with that is that it's difficult or impossible to really think about what those would look like in terms of a system. And so maybe that's not the right language to talk about systems thinking, like systems around a society or an environment that's not obesogenic, causing obesity, or a food system. So it turns out that these medical model and our model of food production or agricultural production are kind of similar in the approach of being somewhat reductionist. And for both of them, I think a systems thinking approach works a little better. There's also biology now that links food systems to health systems. And you'll see at the bottom, the source for this graphic was before she ran for president, Jill Stein was a physician that I co-authored with, and along with another colleague, Ted Shetler, and the two of them did a great chapter in a book called Environmental Threats to Healthy Aging that really laid out some of the mechanistic way of explaining how different things in our environment, like food, like pollution, like diet, housing, can combine to cause inflammation, oxidative stress, which are a common pathway for a variety of the things that we now see as epidemic chronic diseases in our society. So not only obesity, but diabetes, heart disease, poor lipid profiles like bad cholesterol or low HDL. I won't go into this in great detail, but I wanted to make you aware of it. So what do I mean by a food system? Like if we're thinking about food and agriculture as a system, it really means everything that goes into making food from the farm level or even upstream to the downstream processing, transformation, distribution, and ultimately consumption of food. And I suppose composting and what we do with the food waste as well. So there has been at least from my perspective, I put together or helped put together a couple of the first conferences linking health outcomes to food systems, and they're listed here. More recently, my collaborator, Ronnie Neff, who's at the Johns Hopkins School of Public Health, has put together some public health textbooks, Introduction to the U.S. Food System, Public Health and the Environment, and we've co-authored some things in health affairs. These are all great resources if you want to delve a little deeper, because obviously it's hard to capture some of the nuance of this whole discussion in a 40-minute webinar. But suffice it to say that one of the challenges we face now is that we've created a system where the most affordable, the most accessible, the most inflation-resistant foods, and I'll explain what I mean by that, are actually unhealthy foods. They're calorie-dense, nutrient-poor, highly processed, i.e. junk food. And that's the system we're in right now. And that's what we're hoping to do something about. And that's, as I said, costing us arguably tens or hundreds of billions of dollars a year in all these disease and related costs. But the costs and the problems aren't just ones related to poor nutrition. They're actually much broader than that. They include multi-drug resistant bacteria on food because of the antibiotics being overused in livestock production. They include the fact that farmers are disappearing. They're aging out, and younger people either don't have the means or don't want to farm. Climate change, obviously, a huge one with more frequent extreme weather events. And then all sorts of other things, poor water quality, poor soil health, hence the name of the seminar on Thursday, and other things, food pollutants, plastic packaging, poor jobs for food workers. So all of these are what I would call the interrelated pieces of the food system and the related health outcomes. And I really want to focus, because it gets short shrift, on the farm end of this equation, where I think a lot of the problems stem from industrialization. So this is a picture of what farms used to look like. They were, the majority farms, they were kind of their own systems. They were farms where a lot of different things were produced, and the farmer would create some manure from a few animals, and you would use that manure to then recirculate as a nutrient for row crops maybe, and the row crops would then be fed back to the animals. It was a diverse system with a lot of products, tend to be smaller in scale, much smaller than what we see today. And the animal production was linked to the crop production. And they were pretty, you saw landscapes like this. But that's not really what we have today. Now our farms, more often than not, especially in the middle part of the country where I'm from, look more like factories. By that, I mean that they have inputs and outputs, and this is the language that the land-grant universities use to describe conventional farming, and it's the language that farmers use because they're part of the system. It's a focus on inputs and outputs. The farms are super specialized. More and more you're seeing farms that just do one thing. They either grow soybeans or corn if they're a crop farm. If they're a livestock farm, they're growing just pigs or just cows, and generally one life stage of that animal too. And they're very resource intensive. And of course, this is what they call production agriculture. And it's got a lot of health impacts, which I'm just going to touch on. So any questions there? I think the moderator is going to see if there's any questions. I just wanted to break up the talking a little bit, give people a chance. Otherwise,
Hello. Hello, yes. So we do have a few moments for questions before we move on to the next portion of the presentation. So does anyone have any questions so far regarding the presentation? You can enter it in that chat box. You can also enter it in the Q&A section.
If not, let's just keep moving on, and we can pick them up in the next segment too.
I actually do see a question here. One question is, do you think that hormones fed to animals to make them fatter for slaughter enter the bloodstream of people when they eat meat, making people fat?
Yeah, I'm going to address the hormone question in the next segment, so let's hold off on that and return to it, if you don't
Okay.
mind.
Oh, absolutely. And then
Yeah.
we also have one other question. Should farms be discouraged from allowing produce to rot in the fields because it isn't pretty big enough shaped properly?
Oh, we're not really talking about food waste in this, but food waste, especially at my organization, we've been working on food waste in a big way, and there's that's certainly a component of that problem, and it's a huge problem from a lot of dimensions. It's not necessarily a health problem, so I haven't focused on it, but it wastes a lot of resources. If we're putting inputs into these, water, fertilizer, labor into growing the food, we ought to figure out ways to use all of it. But as much as half of the food that we produce ultimately gets wasted, and a big piece of that's in the fields. So,
Great, thank you. I think that is the questions for now,
yeah,
and I'll hold on to that first question and we can revisit it.
great,
All right,
thanks.
great, thank you.
So, to understand the farm system we have at the farm level, it's good to kind of take a satellite view, and that's what I've got here is the Corn Belt. I'm from right in the middle of that. You can see a little place where the Twin Cities is, but a lot of what you see is that kind of burnt orange color, right? That is row cropping, and it's literally so vast that it's changed what the landscape looks like from space. The water bodies are blue, of course. The population centers are kind of bright red from the light, but gosh, a huge section of the middle of the country is corn or soybeans. And that's not by accident. We've created that landscape. We've just like the way we've created the food system deliberately, in part. But the reason this really accelerated, well, let me just say it started off over 100 years ago because this landscape was largely depopulated. And after the Homestead Act, a lot of farmers in these areas that we're looking at from space needed something that they could grow and then ship to the population centers to try to make some money. And row crops were inexpensive, easy to ship. You could dry them. And that's still somewhat true today, less so than it was then. But for many of them, they would grow produce for their own consumption, maybe for their neighbors. They would grow animals kind of as a cash reserve, but also for their own consumption. But what they grew to sell to market were, hay, corn, soybeans, and other row crops. Now, what really changed, though, was World War II, because what happened in World War II is that they found that a large number of the conscripts were malnourished, were actually not able to meet standards in the armed forces because they were malnourished. And it really made the country as a whole look at the food system that we had. And the solution was actually to try to increase the number of calories. And the thinking was, it was kind of simplistic, was that if we just produce more calories, we're going to nourish more people and we'll have a healthier population and one that's able to be more ready for combat. And that provoked a push into production of what's easy to produce, which is these row crops. And over time, those policies were expanded, and basically they morphed into a trade policy as well. And after 1974, the Agriculture Secretary Earl Butz for Richard Nixon actually put in place a cheap food policy, which is really a cheap calorie policy, which is oriented towards producing fence row to fence row as many row crops as we can. And there were other factors at play in addition to policy, but that was a huge driver and continues to be a huge driver today. So lots of implications of this. So focus on production, and you tend to get relatively few crops, I talked about. But there's also a delinking of crops from animals. And so you've got a lot of these farms, and suddenly we're producing, millions, hundreds of millions of acres of corn and soybeans, many, many more than people can eat. In fact, most of those are not for human consumption. The vast majority are for animal feed or biofuels. So we're not even eating all this stuff that the farms are producing. We're turning those calories into animal feed and then shipping some of that, either the finished animal products or shipping the feed itself overseas. So it's really export driven. And the calories aren't necessarily going to people. And as I said, lots of inputs, fertilizers, pesticides, antibiotics, because the focus is not on reducing pollution, it's on increasing production. Well, it succeeded enormously. If the goal was to generate a huge amount of cheap calories, one way you do that is you produce as much as possible. And the impact of that on prices to the farmer is that the real price of corn and soybeans has dropped dramatically. In fact, many years, over the last 30 or so years, many of those years, the market price for corn and soybeans doesn't even cover what it pays, what it costs the farmer to produce those crops. And so a variety of programs have been launched to basically keep the farmers in business when the prices are so low, and to keep the animal feed cheap so that the big meat companies can benefit from cheap inputs. And that continues today. Lately, we've been talking about a bailout of the soybean farmers because the trade policy is really hitting them quite hard. The other impact is cheap food prices, but not all foods. In fact, fresh fruits and vegetables, what I call healthy foods, have increased in real terms, at least through 2000. I haven't updated this graphic, but I think still the lesson, the story is the same, that over much of the last 40 years, 30 years, the relative prices of healthy foods versus processed unhealthy foods has diverged. And the healthy foods have gotten more expensive and the unhealthy foods have gotten less expensive. Not such a good scenario. So soda pop is kind of the outlier there at the bottom of the scale, which of course is sugar, corn syrup. And if you look at the USDA's tracking of per capita calories available from different food categories, you see that there's this huge increase in calories available, and therefore calories consumed by corn starches, by corn sweeteners, and then added fats and oils and soy and cooking oils, which are mainly soybean related. So big change in the food environment, which is why it's not all about individuals eating differently. It's also about the environment changing dramatically, making all these unhealthy calories so much more available. And at the same time, what are we not doing? Well, we're not growing what we're telling people they should be eating. So we're not growing enough fruit in order for everybody to eat domestically produced fruit according to USDA recommended guidelines. We're we're not growing nearly enough beans, only 18%. And because of that, consumption of those things is too low. So price is obviously a component of that, so is availability. So another factor with this industrial model is that we're not only creating a lot of cheap calories, we're creating a lot of food pollutants. So this is where the hormones come into play. And hormones are not only the hormones that we put into cattle production, for example, but also the hormones that are put into linings of cans, like bisphenol A, which I'm going to talk about a little later. There's pesticides, obviously, which become residues in a lot of different foods. There's mercury in the fish supply, which is related to other kinds of policies. There's synthetic food dyes. So the red ones are things that make their way into the food supply, not intentionally, but as a byproduct of some industrial use somewhere else. But the green ones are things that we consciously have put into the food supply. So we've fed arsenic compounds to chickens to make them grow faster. We've used organophosphate insecticides like chlorpyrifos, and it makes its way into the food supply, even though we know it harms children's brains. Very solid science on that. And then these synthetic food dyes, like yellow dye number 50, red dye number 40, these are known to affect children's behavior and learning, but they're often unlabeled on food products in the US. So food pollutants. And then finally, there's these environmental things that are happening. Like if you've got a very carbon-intensive food system, which we do, you're creating a lot of methane emissions, nitrates, all of which are greenhouse gases. And so you're affecting climate change. You're also, from the antibiotics that are being fed to livestock, we're hastening the development of superbugs, which end up on food, but also in the environments around our communities. And then there's things like the dead zone in the Gulf of Mexico, which is directly related to the kind of agriculture we're doing. So let me pause again for one question, if we have any.
Sure. We have someone asked, some argue that adjusting crop subsidies to reduce subsidies for corn, soy, and wheat will increase them for fruit and vegetables and wouldn't help improve the gap in prices. What do you think?
Can we hang on to that one? I'm glad to hear it because it's going to allow me to pull it out later, but we're definitely going to talk about that.
Okay, great.
Okay, great.
And then the time is 10:58.
Thank you. So we're half an hour into it, right? Yeah. All right. So this is kind of what a systems vision of a healthier food system, at least from my perspective, looks like. You see soil health up there. And some of the practices that we would need to bring about in order to reach that would be, to try and avoid so many antibiotics and fossil fuels. That's a huge one. To get back to a kind of agriculture that we call multifunctional, agroecological is another term for it, resilience-based. It's basically a kind of agriculture that asks at the outset, not only how can we produce as much as possible as cheaply as possible, that's only one thing that we're worried about, but how can we produce the healthiest outcome? Or how can we produce a farm that has the most resilient soil, for example? But there's all sorts of other benefits because, again, it's a system and these outcomes are all interrelated. So how do you do that? Or is it even achievable? Well, I think to be achievable, there's got to be a lot of different factors. It can't depend on subsidized fossil fuels, which it does now. So fossil fuels are so cheap that it has made them overutilized as inputs on farms. There's got to be an infrastructure to support this kind of agriculture, and it hasn't been supported in the past. In fact, much of the land-grant universities have supported completely the opposite. There's got to be local zoning to support it, which is often not the case. And then farm policy, which I'm going to talk about later. But policy is critical, and that's the point I want to make. So different kinds of policies. We know that local policies can be effective at changing environments. And the way Kelly Brownell, who's a kind of a hero of mine at Duke, he talks about a reframing. So instead of focusing on individual choice alone, let's focus on creating the environments that make the healthiest choices the easiest choices. So we've done this like with smoking lounges, right? We make it less desirable for people to smoke, make it harder, less accessible. If you put parking in the back of big lot stores, people walk more or they bike and drive less. If you create biking lanes, people bike more. If you tax sodas, people drink less, and we know soda's toxic, basically. The more sodas you drink, the more adverse health outcomes you have. So there are food-related local actions that can be taken. And the Institute of Medicine has recommended that these be a feature of how communities address and prevent childhood obesity, for example. We're succeeding in changing the marketplace. So just by shopping organically, and I don't think organic is the be-all and end-all, but I also don't want to minimize how important it is. Organic food sales are exploding much, much faster than all food sales. And organic is better because it doesn't use pesticides in the same intensity. It doesn't use carbon in the same intensity. It's a more systems-based approach. It doesn't use antibiotics by and large. So it avoids a lot of these adverse environmental and health impacts that we're talking about. Now, of course, there's always pushback with any policy change, but especially around food and agriculture policies. And so Kelly Brownell, among others, has written about the parallels between the battles that were fought around big tobacco and the battles now being fought around, for lack of a better word, big food. So a lot of times, commercial entities that benefit from the current unhealthy food system will try to say, oh, there's not good science about this, or people are trying to be food Nazis by having soda taxes. And that's one framing, but the other framing is, what a great investment it is to make an environment harder to consume soda rather than water or milk, for example. Another thing we could do is, I know I'm going to run a little long, but I'll try to speed up. We can think about city ordinances like this ordinance passed last year, and it's going to actually require bigger retailers in San Francisco to report on the antibiotics used in the production of the meat and poultry that they sell. Well, why is this necessary? It's necessary because right now the consumer, the shopper, has no information on how much antibiotics are used in the products they want to buy. And so they can't make an informed decision. So this is a marketplace change that's going to result in better and more informed decision-making by shoppers. And it's an example. NRDC worked very closely with the San Francisco Department of the Environment to get this in place, and with the city government. Other successful campaigns are, somebody talked about hormones earlier. Again, bisphenol A is a synthetic hormone that's very harmful to children as well as others. Most of you probably know that it used to be in baby bottles and children's sippy cups and even in infant formula containers. Much of that's now ended. But it ended starting with states like Minnesota, where my then group, worked in a campaign called Healthy Legacy and convinced the state legislature to do bans, progressive bans. And then FDA kind of followed, and I think that part in blue at the bottom is interesting, where FDA said, this isn't a safety decision, rather it's based on the fact that the market has abandoned the use of bisphenol A. Well, why did that happen? It's because people like us raised public awareness and got the retailers to start rejecting products made with bisphenol A. So these are some policies that can be successful and have been successful. Chlorpyrifos, I mentioned this earlier. This is a really nasty chemical. It's also widely used on children's favorite foods like apples, oranges, and berries. It's a toxin, a really potent toxin to the developing brain. So it makes children learn less well in a significant way. But the EPA itself found just a couple of years ago that the residues of this toxic pesticide on children's foods and others can be as much as 14,000 times higher than what the EPA deems safe. So again, NRDC had brought a lawsuit to bring about the end of chlorpyrifos use as early as 2000. And at the end of the last administration, EPA promised that it would enact a ban on these food uses. One of the first acts under the new administration was to reverse that ban. But subsequently, Hawaii decided a few months ago that it was going to ban it as a state. And then just last week, Cal EPA declared that chlorpyrifos was a toxic air contaminant. Basically, this lays the groundwork for the ban in California as well. So again, state-based policy actions can succeed and do succeed. And we're asking individuals to act to try to get the EPA to ban it nationwide, but I don't have to tell you that that's an uphill battle at this point. So finally, I want to just acknowledge the Healthy Hunger-Free Kids Act. This was the Child Nutrition Act. It's the formal title from 2010. And this was something Michelle Obama championed, and it was really significant and groundbreaking as a national piece of legislation. Among other things, it is where the funding came from for the farm to school programs, the initial ones, funded at a very low level, but they really took off. And even in subsequent legislation, that funding continues to increase. Why? Because farmers like to expand their markets by being able to sell to more school districts. So it's good for farmers and it's good for kids. And it has positive health outcomes by increasing fruit and vegetable consumption. Shouldn't be a partisan issue, I don't think. And yet, very lopsided vote in that case. And, now certainly food stamps, as we'll talk about, are becoming a very partisan issue. Farm Bill is kind of the grill in the room. Very complex piece of legislation, but you can't not talk about it. Why? Because it's so huge. Almost $500 billion in the last 2014 Farm Bill. So nearly $100 billion a year, of which 80% would go to food stamps and other nutrition programs. So there's a lot in the Farm Bill. The focus on direct subsidies they're certainly in there. They're not subsidies for corn production anymore. They're subsidies for crop insurance, but they still tend to skew to support those big row crops that have always been more supported, and relatively little or much less is supporting organic agriculture or fruit and vegetable agriculture, for example. Now, the big problem with reforming the Farm Bill, like to bring about a healthy Farm Bill, for example, is that over time, the committee in Congress that votes on the Farm Bill, that writes it, is stacked with lawmakers from the states that grow the corn and the soybeans and the other staple crops that have benefited from past Farm Bills. So there's a lot of inertia packed in there, and that makes it very, very difficult to steer a healthier Farm Bill over time. Where is this farm bill going to go? Who knows? I mean, the House and Senate versions are very, very different. Nevertheless, there's a lot of debate right now going on around food stamp eligibility tied to work requirements. There's a lot of anti-environmental riders packed in the 700 or 800 page farm bills. There's one provision that was introduced in the House bill that I wanted to call out, and it would actually prevent states from having any say over their local or state food systems, saying that it would be an interference with interstate commerce. And this could be an incredibly damaging amendment if it were to pass. So let me just keep going, and we'll wait for questions at the end. So what can you do? There's a lot you can do, either as individuals, as health professionals, in your community, among your peers. And I think for all the reasons I said, this is not going to change on its own. It's only going to change if it becomes a priority issue by people who advocate. And that means you and I and everyone. So, there's baby steps, like how do you do advocacy? Part of it's just talking, writing, getting up and speaking, whatever venue you find yourself in. But there's also building bridges with your local governments, with your policymakers. They really don't hear enough from constituents. And believe me, if you haven't gone and talked to them, it really makes an impression. So people think it doesn't, but it does. There's even, like, among the AMA, if you're a physician, you might think that they haven't said anything in the AMA about sustainable food policy, but in fact they have. They've encouraged a healthier farm bill. I mean, who knew this, right? But some of the resources that one would need to advocate are already in place. They're just not being utilized as much as they could be. There are issues like the plastic straw ban in San Francisco that come up that give you an opportunity to practice. Like, this is a way to say, hey, plastic straws are important, here's why, but the food system has a lot of things we need to work on. And, straws are only one source of plastics. There's also plastic food packaging and plastic bags and bisphenol A in plastics and other chemicals in plastics. So I think one needs to look for opportunities to change these. Then there's hospital environments or schools where we can do things like have gardens at schools or at hospitals. Here's one in Ann Arbor where they're farming 30 acres on the campus of the hospital. Great way to kind of practice what you preach. People understand more when they have hands-on involvement. Again, not the be-all and end-all. It's not going to change the whole food system, but it's another piece. More comprehensive is something called the Good Food Purchasing Policy, and many cities in California are actually trying to pass this. Here's a website where you can find out more about that. And then what I'm doing is using my job at NRDC to try to organize more of my health professional peers. I'm restarting something I'd started earlier called Healthy Food Action. So if you are a health professional, ask me about that later. But at NRDC and through these social media channels, we're looking at things like mobilizing public input on pesticides, eating less meat, reducing antibiotic use in livestock. So, and then finally, a lot of these things are only going to be solved politically. What we need is really a charter for a healthy farm bill. That's a very long-term proposition, and we can talk more about that as well. So I'm going to end there and take questions from y'all.
Great. Hello. Yes, we have quite a few questions that have come in. The first question is, they're looking for some discussion about literal obscenegenicity of food system contaminants. And I may have pronounced that wrong.
Literal obesogenicity?
Yes, that is it. Obesogenicity.
So let me just go back a little bit and show you a slide. You can still see this, right?
Mm-hmm.
So contaminants are among the things that cause these same common mechanisms like inflammation and oxidative stress. So that could be a chemical like a dioxin or a PCB. It could be a food packaging contaminant like bisphenol A or a phthalate. But they act. But there are other things in our diet that do the same thing. When you barbecue and you get too much char on your food, when your body tries to process that, it's also creating oxidative stress and inflammation. When you eat a diet too high in sweeteners or high fructose corn syrup, you're causing inflammation. And it's the combination of all these things together that can contribute to chronic diseases like diabetes or obesity. So it's really hard to explain, to say. You can't really say that consuming product A or consuming too much of one thing causes diabetes or obesity, because it's a system, and inside the body they're all interacting. The way out of that dilemma is to think about a diet that goes in the other direction. How do I consume a diet or create a food system for myself, for my family, that's less inflammatory, that's high in antioxidants, that is lower in added sweeteners, so that I don't get as much inflammation? I hope that answers that.
Great, thank you. Another question said, thank you for helping ban BPA. What do you think of BPA replacements such as BPS?
Yeah, good question. If you remember the slide I had about Minnesota in our Healthy Legacy campaign, the early bill that we passed tackled bisphenol A, but very quickly the replacements started to appear, some of which were untested, some of which had preliminary testing showing that they might be have some of the same problems as BPA. So in fact, we had subsequent bills that would ban the alternatives if they had evidence showing some of those problems. It's a common, we have tens of thousands of chemicals in widespread use in our economy, and most of them have little to no testing on their health impacts. And so it's a common problem that when something starts showing to be really bad for us, like perfluorocarbons, i.e. Teflon, and companies stop using it, they often replace it with other things that are proved to be as bad, if not worse. And so that's why, like, the idea that you can just switch out a bad chemical and put in a good chemical is often not a very effective approach. And instead, we need kind of this wholesale rethinking. Like, how do you produce things without fossil fuel-based chemicals? How do you package foods without plastic? How do you take home takeout without plastic, etc.?
Great, thank you. Another question is, in addition to obesity and diabetes, do you find health impacts extending to brain development in young people? Do you see any cognitive development impacted by a nutrient-poor diet?
Yeah, the problem, maybe and yes. I mean, I would say the problem is if a kid comes in and they've got a learning disability, like, I forget what the percentage is in the US with ADHD. I think it's 15% or something. Where does that come from? Well, who knows? Because they've grown up in the environment they've grown up in, and there's no post hoc way to go back and tease out what their diet contributed versus, lead paint, versus the fact that mom ate a lot of sushi when she was pregnant. You can't after the fact tease out what contributed what proportion of that problem, or how much of it's genetic. Genes are in there too. So that being said, there's a lot of basic science that says definitively that any exposure to lead contributes to learning and developmental brain problems. Any exposure to mercury, including in the food, contributes to learning and developmental and brain problems. Arsenic is a known carcinogen, also has effects on the developing brain. And we used to feed it to chicken routinely. So I think, did that answer the question? I'm kind of spacing on what the question was again.
Oh, sure. Yeah, if you would like any further information about that question, whoever the question asker was, you can just chat us about that.
Yeah.
Another question is, how do you make the distinction between inappropriate prophylactic antibiotic use in livestock and necessary antibiotic treatment? Are antibiotic meat milk withdrawal times appropriate?
Well, I won't address the withdrawal times. Those are legislated, so they're required. And they mainly deal with trying to reduce antibiotics residues in meat that people eat. That's not the issue, primarily the public health issue that we're most concerned about, or that the public at large is concerned about. The issue is when you put antibiotics routinely in the feed, you spur bacteria to develop and spread that are resistant to those antibiotics. And those bacteria not only get in on the food, but they get all throughout the environment around the farms. They drift downwind of the farms. They end up in the water supplies that the farms feed into. So we're creating these enormous environmental reservoirs of resistant bacteria and resistance genes that are making their way to the human population and worsening the epidemic of antibiotic-resistant infections. So the solution to that is to try to reduce antibiotics wherever we can. And about 85% of the antibiotics used in the U.S. in livestock production are feed additives. So they're not used to treat a sick animal individually, like a cow or a pig. They've often been used in animals or herds that aren't even sick yet. In Europe, this is no longer done. They've gotten rid of feed antibiotics, use in feed of antibiotics that are medically important. They've largely stopped that or are in the process of. In the US, we've not only not stopped it, but we've redefined, the FDA has redefined feed antibiotics for prevention as being therapy. So they've kind of blurred the definition between treatment and prevention in a way that they don't do in other countries. So NRDC's position and my position is, because we know that antibiotic use, whether it's good or bad, helps to drive resistant bacteria, then the solution is to only use it when you really have to, which is really to treat disease, and avoid using it when there isn't frank disease diagnosed and being treated. And that's not what we're doing in the US.
Excellent. We have another question. You mentioned soil health as a key component to the system's vision for a better food system. What do you mean by soil health, and what farm practices are important for improving soil? And before I hand this question over to you, I also want to let everyone know we do have an event this Thursday, Health from the Soil Up. We'll be having a full day of education on that topic. So that's another source for information. Thank you.
Yeah, gosh, I think I should just tell people to go to the event on Thursday. But, there's a variety of things. Soil is a living bioenvironment, right? And we've forgotten that in terms of our research at the land-grant universities until recently. And so, one of the ways you maintain healthy soil is by having a high organic content. But if you're doing continuous cropping and you never replenish the organic material, if you're only putting phosphate fertilizers on the soil and not putting manure or cover cropping, in other words, circulating, clover or some other cover crop in between your corn and soybeans, you're using up the soil fertility. And that's what's happened throughout a lot of the prairie, is those huge fertile soils have are being lost at a very rapid rate. Organic matter is only one good thing. There's also bacteria that are really beneficial. And again, when you put antibiotics into animals and the animals dump antibiotics into their manure, you're changing the microbial flora in the soil in ways that may have an impact on what is grown in that soil in ways that we don't yet appreciate. Those are just two examples. There's more. There's a lot of implications for climate change, for example, for the ability of the soil to absorb water and hang on to it. So in the case of drought, a healthy soil is going to be much better at being drought resistant than a depleted soil.
Great, thank you. And we have a couple of questions also about as it relates to subsidies. So one is regarding lowering subsidies for grow crops and increasing them for fruit and vegetables to reduce the price gap, and if this would lower the cost of healthy foods for consumers and possibly raise the prices of cheap processed foods. And then another related question has to do with the current trade issues going on right now, and if they might inadvertently discourage industrial ag and commodity production and being shipped to China and nudge farmers into producing real food that can be eaten domestically.
I'll see if I get to the second one, but my short answer is no, I don't think it'll do that. But the first one, that first of all, I want to clarify that we're really not subsidizing direct production. We used to do that, but that hasn't been done for 20 years or so. Now what we're doing is we're paying for crop insurance, and that is a kind of a subsidy. Basically, the taxpayer is underwriting insurance premiums primarily for row crop farmers. And I think initially those were largely extended to corn and soy and other row crop farmers. I think that they've, to some degree, been extended. Let me back up a second. The reason a farmer needs insurance is because if they get one bad year, potentially they can fail, and then they lose the farm, which nobody wants, I don't think. And especially with a more climate-affected environment in which to farm, the risk of some extreme weather event happening is increasing. So farmers know that their job's getting riskier. So they need insurance. And what they're getting now is both a big portion of their insurance premium paid, as well as higher payments when they do have a crop loss. And in the past, those benefits were extended more to the big commodity crop farmers than they were to things like fruit and vegetable producers. So I think there does need to be equity in terms of extending those benefits to different kinds of farmers. And I'm not sure whether we're there yet in terms of that equity. I think, though, that it's still a short-sighted solution to a long-term problem. If the long-term problem is to create farming systems that are more resilient in the face of extreme weather events, we're not doing that. We're by and large still farming conventionally in ways that leave farmers vulnerable to extreme weather events. And the reason, so we need to put more money not only into insurance premiums, but into research for how to grow crops, whatever the crop is, in a way that's more resilient. There are other things we can do, though, to help balance out fruits and vegetable production vis-a-vis corn and soy production. Corn and soy, it's just a lot easier to raise a huge amount of corn and soy and it's easier to store it and ship it. So there's some built-in advantage to those things. We've made it worse through decades of investment. So if you think of the entire infrastructure available to the corn and soy farmer, it's not only today's insurance subsidies, it's also, the fact that for the last 60 years, there have been investments in extension programs to help them get more efficient, to increase yields, to develop better varieties that are going to have higher yields. And all these things add up to a tremendous advantage that has increased over time. We haven't extended that same research advantage to fruit and vegetable production. We don't extend the same advice in the form of extension services to fruit and vegetable production, at least in many places. Maybe in California they do, but not so much in places like Minnesota or Illinois or Iowa. So I think it's going to be a very long road to have more balance between supporting farmers of fruit and vegetables versus corn and soybeans.
Great. Thank you so much for joining us. It is now 11:30, and we did have one more question if you have time for one more.
Sure.
Otherwise, we can end. Okay, great. And this, we might need to do a Cliff Notes version of this, but someone was wondering if you could sketch a roadmap for advocates to get their communities to embrace local polyculture rather than industrial monoculture, how you might go about organizing changes in zoning, getting schools and governments to source sustainably and responsibly, and how you get governments to treat the health costs of food as internalities rather than externalities.
Yeah, I can't tackle that in a one-off answer.
Mm-hmm.
I would point you to a couple of states that put together food system charters. And the two that I know best are one in Iowa and the one in Minnesota that I participated quite a bit in. And the Minnesota Food Charter was really a pretty sophisticated document that addressed a lot of these various points and came up with some options. Now, I think there is no one single roadmap because, there's options and different communities are going to choose where to put the emphasis differently. I think what's common to all communities is just involvement. There's got to be more civic engagement around this stuff. And I think, there's definitely examples of communities where there is more involvement, and California's got a lot of those, but so does Boulder, so do the Twin Cities, so do, the Northwest. And in general, they've seen improvements in, school food, for example, more support for local foods, more farmers markets and access to farmers markets, so more fresh produce. And no one of these things is going to change the eating or change the food system overnight or completely, but you start seeing a collective benefit when you add more of them together. In the short term, foundations can play a role in lifting up some of the best practices, but I think in the long term, we've got to find better alignments in the marketplace. And that's why things like giving people more information on the labels so that they can align their values with the food that they're buying is really important. But it often leaves lower income people out of the equation. So that's a particularly tough nut to crack that, will have to be discussed in other venues.
Great. Well, thank you so much for joining us, Dr. Wallinga. It was a pleasure to have you. And thank you to everyone who joined us online today. We will be sending out a link to this recording via email. I also wanted to let you know we do have that upcoming symposia this Thursday, Health from the Soil Up. It's on August 9th in Berkeley, California. It's an all-day event. We are getting close to selling out, so if you're interested in attending that, I do recommend you register as soon as possible. Also, COEH does have monthly webinar series, which is usually the first Monday of every month at 10:30 a.m. Next month, on Wednesday, September 5th, we're honored to welcome Beverly Nichols and Matthew DeAngelis, who will present on respiratory protection in the workplace. You can find details about all of these events online at coeh.berkeley.edu. Thank you all so much for joining us, and I hope you have a great day.